I wish that somebody would have told me all these things during my counseling. But today, I know better. So I'm going to make sure that I help you out by guiding you in the right direction. Hi, doctors. I am Dr. Ichita Joshi, a prosthodontist and a digital marketer who's on a mission to uplift dentists. To be honest, even after securing All India rank 151 in NEET MDS, my perception was always that if NEET exam is this difficult, then counseling is this difficult. Why? Because for the NEET MDS exam, you have textbooks, you have coaching institutions, you have people who can guide you on the exam. But when it comes to counseling, everything is a chaotic mess. And the things that you figure out is what you ask other people, like how is your college, how is this department, which branch to choose. And there are no set rules for all that. So if you're feeling lost and confused about this whole counseling process, then don't worry. I totally understand how you feel because I was once just like you. In this video, I will be giving you some insights as to how to select your college for MDS. So watch this video till the end because I will be giving one bonus tip which nobody talks about. So number one criteria is branch preference. So I want you to decide whether you want to go for a clinical branch or a non-clinical branch, and I want you to make a list of all the branches that you like, why you like it, and at the same time do your own research work. Ask clinicians, ask academicians who are practicing in this branch since a long time, because what you see in college is very different from what the actual clinical scenario is. What I did was I made an Excel sheet in which I used to fill all the columns based on specific criterias on what all things I want to see in colleges. And based on the information that I get by talking people, I used to fill it. And trust me, that whole Excel sheet was a jackpot. And it helped me so much during my counseling, my choice filling. So if you want that Excel sheet format, just let me know in the comments and I will make another video on it. So, based on all the data that you collect after talking to people and your personal interests, it's important that you make a list of branches based on your preference. For example, preference number one, prostho, preference number two, endo, and so on. And it's important that you also have your backup branches because you should be prepared for anything during counseling. I think more than knowing what you want, it's more important that you should know what you don't want, what is absolutely non negotiable. Also, remember that even in the most top rated colleges, it's not important that all the branches are good in it. And even in the most average college, one or two branches might be really good. So, having a good blend of a good college and a good branch is important, but when in doubt, always go for branch preference. Why? Because college is just for 3 years, but branch is for lifetime. So I don't think I've encountered many patients who have asked me specifically about my MDS college, but everybody asks me about what's your specialty, which branch are you from. So it's like a lifelong thing, it's a tag that you will carry forever. So choose your branch wisely. Now, second thing to keep in mind is your college preference. Now decide whether you want to go for a government college or a private or a deemed. What is non negotiable for you? Do you only want to go for a government college or do you only want a college which is close to your hometown? So make sure that you already know what you want. The college reputation matters a lot when you're applying for jobs, when you're working in a hospital or you're moving abroad. So that is a reputation and a tag that you carry with you. And if there are two candidates, one is from a really good college and one is from an average college, so some bias usually comes. People will prefer the student who's from a good college. So it's as simple as that. So, one hack that I'll give you here is if you want to figure out which colleges you will probably get in the counseling, so download the previous year's allotment list, probably 2, 3 years back, and then check out your rank and check out 10 ranks above yours, 10 ranks below yours, and then make a list of all the colleges which are out there. And trust me, the college that you will get will be more or less similar to that list. So this is just an approximation, but it's based on the fact that all these allotment processes, they somehow follow the same pattern each and every year. Another important thing to keep in mind is the patient flow. Because even if your college is having all top class equipment, but there is no OPD, then whom will you treat? What will you learn? So it's important that you make sure that the OPD numbers are decent enough. You should definitely ask people who are currently studying there to know the current scenario. So you can ask UGs, you can ask PGs, or you can also ask recently passed out alumni to get an idea of how many patients come to the college each and every day. And don't rely on the website data that the colleges give, because the numbers might be exaggerated. We don't know how accurate it is. So, this is an unsaid rule which is pretty easy to figure out, and that is more number of patients means more hands on experience. And that's what you are joining MDS for, so that you learn so many clinical skills that once you graduate, you are a specialist, a master in something. Another thing that is really, really important is the faculty and the HOD. So look up to their names on Google, LinkedIn. What have they contributed to dentistry, and what are their mentorship skills, what publications they've done, so that you know that your guide, your HOD, your faculty will be mentoring you in a good way. Remember, even if someone has all knowledge and skills, but if they don't know how to communicate it to their students, then it's of no use to those students. So, having a good mentor really, really matters. So, one of my friends who is currently doing PG from Maharashtra, she told me that her staff is so proactive in teaching their students and PGs, and they make them feel independent, and so that once they pass out, they become really well versed clinicians, and they give them free hand, and they give them full support and guidance, and also push them for research work. And the staff is also in touch with the PGs even after they graduate. I mean, they help them in getting jobs and getting them clinical exposure in various clinics. I mean, that's amazing. And sadly, in some places, the situation is like a toxic master slave kind of situation, where most of your time is wasted in doing the personal work and favors. And yes, it affects your mental health, it wastes your time, it wastes the opportunity that you worked so hard for. You've given NEET exam, you've cracked that seat, and it's not easy to come here. So somehow I feel in such places the hard work that you do is not justified. So I remember one more of my friends. She was telling me that her HOD has told her that I will not teach you this, because what if I teach you this and you become more skilled than me? And what if you open your clinic right next to mine? So these are the people that you should be avoiding. I hope you get my point. Although nobody will openly tell you about the dark side of the department because of certain limitations and restrictions on the people who are studying there. They want to play it safe, obviously. But still, it's important that you do your background work well by asking multiple people from the same college, so that you get a broader perspective on what is really happening there.